Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Kindly like, subscribe, and share. Have you ever found yourself wondering what Colles and Smith fractures are? Well, let's clear the fog. Colles fractures are intra-articular fractures of the distal radius, characterized by dorsal angulation and impaction. On the flip side, we have Smith fractures, quite similar in nature but with a twist. They display volar or palmar angulation. These fractures are more than just a break in the bone, they're an intricate puzzle for the medical world. Now that we have a basic understanding of these fractures, we can delve into their signs and symptoms. What could possibly indicate a Colles or Smith fracture? Well, there are a few key signs and symptoms to be aware of. Pain is the most immediate and striking symptom. It may be sharp and intense, or a dull ache that worsens with movement. Swelling often follows, as the body's inflammatory response kicks into gear. Then there's deformity, which is a visible sign that something is amiss. A wrist with a Colles or Smith fracture might look bent or twisted in an unusual way. And finally, decreased range of motion can be a telling sign. If moving the wrist in certain ways causes discomfort or is simply impossible, it could very well be due to a fracture. However, it's important to remember that these symptoms can vary depending on the severity of the fracture. A minor fracture might only cause slight discomfort and limited swelling, while a severe one could result in significant deformity and pain. Recognizing these signs early can aid in prompt diagnosis and treatment. Speaking of which, how do we diagnose these fractures? How can healthcare professionals confirm a diagnosis of a Colles or Smith fracture? Well, it all begins with a thorough physical examination. The physician will carefully assess the patient's wrist, looking for signs of swelling, deformity, and tenderness. This examination provides valuable clues about the type and severity of the fracture. Following the physical examination, imaging tests come into play. X-rays are typically the first line of investigation. Offering a clear picture of the bone structure, they can reveal if a fracture is present and help identify its exact location and type. For complex cases, or when more detail is needed, a CT scan may be ordered. This advanced imaging technique can provide a more nuanced view of the fracture, including its depth and the degree of displacement. These diagnostic tests are critical in determining the type and severity of the fracture, and they guide the subsequent treatment plan. Once we have a confirmed diagnosis, what's the next step? Treatment. Scene script. How do we approach the treatment of these fractures, and what complications should we be aware of? Well, treatment options for Colles and Smith fractures can be non-surgical or surgical. Non-surgical methods may involve casting, which immobilizes the fracture to promote natural healing, but in some cases this might not be enough. Surgical methods, on the other hand, offer a more robust solution. These include pinning, where pins are used to hold the broken bone pieces in place, plating, where a metal plate is affixed to the bone to provide stability, and external fixation, wherein a frame outside the body is used to hold the bones together while they heal. However, every treatment comes with its own set of potential complications. Non-union is one such complication where the bone fails to heal. Conversely, malunion occurs when the bone heals incorrectly, leading to deformity or dysfunction. Infections are another risk, especially with surgical methods. If bacteria enter the body during surgery, they can cause serious infections that may require additional treatment. Nerve damage is also a possibility, which can lead to issues like numbness or weakness in the affected area. Lastly, there's post-traumatic arthritis, a type of arthritis that can develop after a fracture. This can cause pain and stiffness in the joint and may require further treatment or even joint replacement. While treatment can effectively manage these fractures, prevention is always better than cure. So, how can we prevent Colles and Smith fractures? Well, let's navigate through some preventive measures. Firstly, engaging in high-risk activities such as contact sports or extreme sports often puts us at risk of these fractures. Hence, wearing protective gear like wrist guards, knee pads, and helmets can significantly reduce the risk. Secondly, maintaining good bone health is crucial. This can be achieved through a balanced diet rich in calcium and vitamin D, combined with regular weight-bearing exercises. These not only strengthen your bones, but also improve balance and coordination, reducing the likelihood of falls that can lead to fractures. Lastly, managing underlying conditions that may increase the risk of fractures, such as osteoporosis, is vital. Regular medical checkups, appropriate medication, and lifestyle modifications can help control these conditions. With this knowledge, you're now better equipped to understand, diagnose, and manage Colles and Smith fractures. Remember, knowledge is the first step towards prevention.